For the last 50 years, Summit Healthcare has strived to meet the needs of the growing communities in which we proudly serve, to provide our patients with the highest commitment to exceptional care and with overwhelming compassion close to home. This mission that has guided us for the last half-century continues today.
2020 marks the 50th anniversary of Navapache Regional Medical Center and Summit Healthcare. My name is Ron McArthur, and I have served as CEO of Summit Healthcare for the past 10 years. It's my privilege to share with you the highlights of our 50-year history of serving the White Mountain communities. Come on in. In the mid-1960s, there were two hospitals serving the White Mountain communities: the Josephine Goldwater Hospital in Show Low and the McNary General Hospital in McNary.
I was actually born in the McNary General Hospital.
In 1965, Phelps Dodge Corporation donated 16 acres of land for the purpose of building a new hospital to replace the two existing hospitals.
Phelps Dodge gave the land to this district for $1, provided that they would build a medical facility that would provide care for Southern Navajo and Apache County, and therefore the Navapache name that came along. And this facility has done a very good job of servicing their community and keeping up with growth and knowledge and quality of care.
In September 1970, a new 28-bed hospital named Navapache Hospital was dedicated, and it opened its doors to patients in December 1970. When it opened, it had 28 employees and 5 medical staff members, consisting of Doctors Patty Garver, Jim Allison, and Jack Mowry, who lived in Pinetop Lakeside Show Low, Dr. Howard Roberts from Snowflake, and Dr. Arnold Disterhef from McNary. The original hospital district board was composed of Bud Nordquist, Al Hunt, Reed Hatch, David Foyle, and Lee McRae.
When I grew up, the closest hospital was in McNary, Arizona. Dr. Disterhef was the main doctor there. He was not only a great doctor, but also a great man. He took out my tonsils at Christmas time during my sophomore year at Eastern Arizona College.
In 1984, Navapache expanded its hospital services. A new 6-bed ICU was added, along with a new obstetrics department with new patient and labor and delivery rooms. The operating rooms were expanded, and a new recovery room and endoscopy room were also added. Now, with 49 beds, Navapache was considered state-of-the-art by small rural hospital standards. In the mid-1990s, the governing board changed the name of Navapache Hospital to Navapache Regional Medical Center to better reflect the hospital's capabilities of serving the healthcare needs of the White Mountain communities. The governing board also purchased 12 acres of land for future growth and development.
The board agreed to purchase additional property, to acquire the land so that we could have that for future growth. And that was really foresight, because we weren't busting at the seams. And it's like when Roma Lee talks about the new surgery department, in our mind, that was gonna carry us forever.
In 1995, the hospital launched an expansion project consisting of new waiting rooms and the expansion of pharmacy and staff dining areas. A second med-surg nursing station was added, which increased the hospital's bed licensure to 54 beds. In 1999, the hospital launched a second expansion and renovation project.
Made the decision to build the surgical wing. That was, financially, that was a huge step. And there was major discussion about repairing and remodeling the old one and not building the new one, trying to figure out how to balance that. And one night we took the board on a tour of the old surgery department. And it was a very easy decision after that, because they could see they were totally outdated and fixing them would be almost impossible.
This project included the renovation of the emergency department, radiology, surgery, laboratory, oncology, medical records, and administration. Also, a new front entrance was added to the hospital.
Was terrific to be able to have the tower and the space and so forth. But also, and like what John said, with the buildings and everything, having the doctors, most of them on campus, has been a big change, and the use of technology here has been awesome as well.
In 2003, the hospital expanded its services by adding a $2 million cath lab and angiography suite. In 2005, a major expansion project began with the demolition of the McNary Clinic, the relocation of the helipad, and the construction of a new 5-story patient tower.
Well, I think, just all the growth that's happened and all of the different specialties that have come in and all the different programs that have been implemented, it's far cry from the earlier days. It's been great to see all the buildings go up. I think when we built the tower, that was a pretty big deal. And the patients could have their private rooms, and then their families would have a place to stay with them when they came into the hospital.
We started out with, our plans was that we'd have a 3-story tower. And we worked on that for some time and then decided that that wasn't big enough, so we went to 4 stories. And then, of course, as everyone knows now, that ended up a 5-story tower.
In 2007, the governing board changed the name of the hospital from Navapache Regional Medical Center to Summit Healthcare.
Navapache was a lot of times misconstrued for a BIA type hospital. And so we felt that if we're ever going to change the name of the hospital, this would be the time when a new tower was going up.
In the fall of 2007, the med-surg nursing units and the ICU were moved into the 1st and 2nd floors of the patient tower. In 2008, the couplet care unit was moved into the 3rd floor of the patient tower. In 2009, the labor and delivery suites were moved into the 4th floor of the tower. And in 2010, a new 8-bed level 2 nursery was opened on the 4th floor of the tower. In 2011, administration, medical records, human resources, and medical staff services moved into the 5th floor of the patient tower.
Back when I had my first child, 19 years ago, the hospital was quite small. It was Navapache Hospital, and the OB floor is where actually radiology used to be, and it had 5 rooms, which was plenty fine, unless you were the 6th person. And the last room available that was near the OB section was really what appeared to be a storage room. It used to be a delivery room, but it was converted. There was boxes and Christmas decorations and red boxes. And as they found that one of the doctors in the hospital was ready to have her baby, they were looking for rooms and had to move stuff out real quick. And I had been there many times, so I already knew that was basically a storage room. That was the room I got. But I had a healthy baby, and the staff were very busy that night. Following
the moves into the patient tower, a 4-year renovation expansion of the main hospital began in 2010. A new outpatient atrium was constructed, and new space was provided for the pharmacy, physical therapy, cardiopulmonary, wound care, women's imaging, outpatient registration, social services, and the laboratory. The emergency department was expanded from 8,000 to 18,000 square feet and from 16 cubicle curtains to 32 private rooms. The radiology and surgical suites were also expanded, and a new 12,500 square foot cath lab was completed. All of these building projects were completed in 2014. Also in 2014, Summit Healthcare acquired the 19-acre Pine Shadow Mobile Home and RV Park for future growth and development. In 2015, the hospital completed a major expansion renovation of the Cancer Center, and in 2016, Summit Healthcare became a member of the Mayo Clinic Care Network.
It is an honor for us at Mayo Clinic to collaborate with our colleagues at Summit Healthcare in the Care Network. and we look forward to continuing to work together to deliver high-quality, evidence-based medical care to our patients and communities.
It's seen all the growth. From a service standpoint, it is the fact that we've been able to grow along with the facilities, meaning we've grown with new providers, new specialties, telemedicine, affiliations with other top-notch organizations, all of which I feel are directed at trying to give better patient care, right?
In 2017, a groundbreaking ceremony was held on the Pine Shadows mobile home property for the construction of a new administrative services building, a new outpatient surgery center, and a new outpatient pavilion medical office building.
I think probably the most significant change I've seen is the new services, the access to care that's occurred at Summit Healthcare, the new specialties, the new specialists, and the services that they offer.
In 2018, Summit Healthcare opened a 10-bed orthopedic center of excellent service. In 2019, the Administrative Services Building, the Outpatient Surgery Center, and the Outpatient Pavilion Medical Office Building were opened. In 2020, Summit Healthcare opened a 12-bed senior behavioral health unit on the 5th floor of the patient tower, providing short-term mental health services to adults 55 and over. In addition to the major renovations and expansions of the main hospital campus, Summit Healthcare established 6 family medicine clinics in outlying communities. 1 in Heber-Overgaard, 2 in Snowflake Taylor, 1 in Holbrook, 1 in Eager, and 1 in St. John's. Summit Healthcare has experienced tremendous growth over the past 50 years. Today, Summit Healthcare is a regional medical center with 101 licensed beds on a 55-acre campus with 347 active and affiliate medical staff members and 1,308 hospital and clinic employees. Thank you for supporting Summit Healthcare over these past 50 years.
Summit Healthcare, here for you then, now and always when you need us. Trusted to deliver exceptional, compassionate care close to home.
It's just been fun. And I think we enjoyed working together. I mean, I really believe that. A lot of workplaces, there's a lot of stuff going on, but we had stuff going on, but we enjoyed doing it together and getting through those hard times together. At least I think we did. And my philosophy is hire the right people and then get out of their way and let them do their thing. And I think we were very successful.
These past 10 years have been the most exciting time of my 43-year career. It's brought me great satisfaction to see the tremendous growth of the hospital to better meet the healthcare needs of the White Mountain communities.